trying to lose weight and achieve a healthier lifestyle can be extremely challenging. Well, here to talk about why weight loss surgery may be an option is bariatric surgeon for GBMC's Comprehensive Obesity Management Program, Dr. Emily J. Waters. All right, so talk to us about the obesity epidemic and about the importance of an all-inclusive obesity program.
Right, thanks, Brandy. Over 2/3 of Americans are overweight and about 42% are in the obese category. That's super important to know because obesity affects over 60 chronic diseases and illnesses. That includes high blood pressure, diabetes, sleep apnea, and even some cancers. So it's very important if you're in the obese category to seek out a comprehensive obesity management program like we have here at GBMC that includes not only surgeons, but nutritionists, mental health experts, physician assistants, so that we can help you reach your weight loss goals.
For sure, it sounds so important. I've actually visited there and talked about the all-inclusive program that you guys have. So can you kind of outline for our viewers what are some of the surgical options that are available to help people who want to really lose large amounts of weight?
So there's two surgeries that we offer at GBMC. One is the sleeve gastrectomy and the other is the Roux-en-Y gastric bypass. The difference between the surgeries are with the sleeve gastrectomy, we take out about 80% of the stomach. So stomach's about the size of a football roughly, and then we sleeve it down to the size of a banana. With the Roux-en-Y gastric bypass, we make the portion of your stomach where food bypasses or goes through a lot smaller, and we reroute the intestines. So these surgeries both have impacts on the amount of food you can eat, but there's also a lot of complex gastrointestinal hormone changes that happen as well that contribute to a patient's weight loss.
So what makes a patient a good candidate to get one of those surgeries?
So luckily, most insurances in the United States now cover bariatric surgery, and there are requirements such as a BMI over 40, or if your BMI is over 35 and you have a comorbidity such as high blood pressure, sleep apnea, diabetes, then insurance will cover the surgery. In addition to that, a good candidate is someone who shows up and is ready to take control of their health, is engaging, asking questions, and is really ready to begin this next step in their life.
So surgery is one portion, right? What do you recommend that patients do before and after the surgery to achieve the success of their goal for a healthier lifestyle?
Exercise is key. Patients who exercise before and after bariatric surgery actually have the best results, and they're able to sustain their results throughout their lifetime. So I always encourage all my patients to start an exercise program, whether that's walking 10 minutes a day. Great. Once that becomes easy, increase it to 15 minutes the next week. So exercise is key to success. And then also diet and nutrition. And really important is the education component of nutrition, which we offer here at GBMC. As part of our program, you'll meet with a nutritionist once a month where you'll learn all about those key facts to nutrition that you need to know.
All right, Dr. Waters, such great information. Thank you so much for joining us. If our viewers need to seek out your services, they know where to find you at GBMC. We appreciate you being here.
Thanks.